okay? All right. Thank you so very much to each of you for being here today. My name is Dr. Nick Efantides, and I serve as the Chief Medical Officer of San Diego County. As the stewards of our region's health, we brought you here together today because we know there is mounting and significant interest in the novel coronavirus, which as of today, per the World Health Organization, has a new name. It is COVID-19. CO for corona, VI for virus, D for disease, /19. We are also aware that there is great interest in the respective roles within our collaborative efforts in our region with our federal and our local healthcare partners. In a moment, I am going to invite Dr. Eric McDonald, who is the medical director for the county's epidemiology and immunology branch, to make some introductory comments. And after those comments, I am joined by three medical colleagues that will collectively answer questions for you all. Dr. Christopher Braden, who is the Deputy Director of the National Center for Emerging and Zoonotic Infections and Diseases. Dr. Randy Taplitz, who is the Infectious Disease Specialist and the Associate Hospital Epidemiologist from UCSD Health, and our own Dr. Wilma Wooten, the Public Health Officer of the County of San Diego. Our hope and expectation in coming together today is to assure the public that they have the most up-to-date and fact-driven information available. And with that, Dr. McDonald, the microphone is yours.
Good afternoon. I'm Dr. Eric McDonald, E-R-I-C, M-C, Big D, O-N-A-L-D, and I'm the medical director for the county's Epidemiology and Immunization Services branch. I have served as the county's liaison to the leadership team that's conducting the federal quarantine at Marine Corps Air Station Miramar. I would like to state at the outset that we have enjoyed outstanding professional relations with all of those involved in this federal quarantine operation, led by the U.S. Department of Health and Human Services, the HHS, and CDC, with the support of the Marine Base and the U.S. Marshal Service. I'm going to concentrate on the specific county role, and to be clear, the county's role is that of, and that of the San Diego healthcare community is one of support. We are assisting the federal quarantine in two areas. First, we assist with the transportation, medical evaluation, and treatment of people under investigation for COVID-19. We call those PUIs. This includes the packaging and shipping of specimens to the CDC lab in Atlanta for testing for this virus. Second, we provide medical care and supplies as needed when the capacity of the medical services in the federal quarantine area are exceeded. So to detail the PUI evaluations that we support, when we are contacted that a PUI, or person under investigation, needs to be isolated at the hospital, we arrange a routine transport for direct admission to the appropriate hospital using CDC recommended guidelines. The hospital providers evaluate and draw samples as indicated using the CDC's guidelines, and they're held in isolation there until CDC communicates the result to the county and our hospital partners. In the event of being informed of a negative result, the evacuee is returned to the base under quarantine by the U.S. Marshals and HHS personnel. We've only had one positive test communicated to us, and this patient was at Miramar at the time, so this person was transported back to the hospital using the same CDC guidelines, and that individual is still isolated there. All other results have been negative or are pending results. I can summarize that there have been 9 persons under investigation involved with the effort at Miramar. 1 of those is positive, 5 of them are negative, and 3 are currently pending. And I'm not going to answer questions about the specifics of those individuals. It is important to note that all of the evacuees have been in federal quarantine throughout the process, being on base, moving off base, being in the hospital, and then returning to base. No people off the base, besides a few, very few, selected medical professionals, have had contact with these evacuees. There is no exposure to the general public. After all, that's the purpose of quarantine. For medical evaluations not related to POI status off base, there has only been 1 incident. This individual was transported and treated using CDC guidelines, and then later evaluated to be sure that they did not have the COVID-19. We know that that patient, in fact, has a negative result and does not have the virus. That individual was returned to the base and is currently in isolation there. So that's the end of my prepared comments, and I'll let others go ahead and open up for questions.
Thank you so much, Dr. McDonald. With that, we will be happy to entertain some questions. If when asking your questions, you could please identify yourselves. I will call on you and then direct the answer to one of our panelists. Yes, ma'am. Based on patient protection guidelines, there are no other details available. Yes, sir.
Yeah, Dave Summers, NBC7. Can you walk us through the process in which this woman who was tested positive was taken from the hospital back to Miramar, and then what happened overnight, and then back to the hospital? Can you walk us through that? Help us understand what contact was made while there, what contact was made while outside the hospital, and in the hospital.
Thank you very much. I will have Dr. Braden respond to that question.
Yes, so I'm Dr. Christopher Braden, C-H-R-I-S-T-O-P-H-E-R, B-R-A-D-E-N. I'm an infectious diseases physician. I work at the CDC. I've been there for over 26 years. So to answer the question about the sequence of events, thank you for asking because it has caused a bit of confusion, and I'd like to put out the sequence of events so that people can understand what really happened. So this is a woman that was on the first flight that came to Miramar Marine Corps Air Station and was well on that flight. Actually, when we screened all passengers when they were deboarded that flight, she screened negative. She didn't have any fever. She didn't have any symptoms. She was assigned a room, and that night she had the onset of some scratchy and then cough. Every day for every person, we check them for symptoms and fever twice a day. That next morning, when she awoke and she realized that she had this cough, she reported that to us during the symptom check, and she was then transferred to UCSD Medical Hospital for evaluation. During that whole time, during the transfer, during that evaluation, she was under appropriate isolation. So at the hospital, samples were taken, and they go through the hospital laboratory, then they go to the county health laboratory, then they're sent to CDC. So for a number of reasons that we can go into if you want to, but the labels on the specimens actually did not meet some of the requirements for accessioning at CDC into the laboratory. And so they actually didn't go into the testing laboratory at CDC. when we were asking about results, and this is one of the lessons learned about, you know, from us as a field team and also at CDC, we were under, you know, a lot of pressure to get results back, and we were asking for results to be reported back verbally. What we heard was that all the test specimens that were accessioned went to the testing laboratory, and the results back were negative. And we said, that's great. All the tests are negative, let's take them out of the hospital. They were discharged, we put them in the van. When we get close to the base, we get a text message that says, important message. 3 of those specimens actually didn't go to the testing laboratory. They were never accessioned successfully, and they weren't tested. Okay, so here we are. We're now going back onto the base, and we have this new information, and we decide, okay, we're going to put these people in their rooms, in isolation in their rooms. Instructed not to leave, not to mingle with the general population there at Miramar Base, and we're going to wait for the results of those tests. Well, of course, as luck would have it, it was one of those tests that came back positive. Let me emphasize, there was no fault of the test itself. The test itself was accurate. The issue was that the test wasn't run when we thought it had been. So let me put that kind of misinformation to bed, that the test itself was accurate. So once we get the result back that the test is positive, why then, of course, go through the same process, transport back to UCSD hospitals and back into isolation, and that's where we are today.
Just for clarification, how many people did that woman who tested positive come in contact with in this back and forth? And can you tell us who are those people, or any of them in quarantine?
Right. So we have done a contact investigation, as we would around any positive case. And, you know, we're comfortable that she wasn't symptomatic on the flight over, and she wasn't symptomatic when she was going through all the screening and so forth. So all of those people are not considered contacts, and we're very grateful for that. There was an instance on the way back from the hospital when we thought all the tests were negative and we were transporting. There was actually 4 people that were transferred together, including her. So we have gone through the assessment of what kind of contact does that really constitute. So we would put that into, at most, the middle risk category and probably low risk category of contact, because all the passengers were wearing masks. It was a short duration, and they then went to their individual rooms for isolation. For those particular people who are evacuees, we would likely monitor their health for those additional few days. It doesn't affect the other evacuees that are here at Miramar as far as their quarantine period is concerned.
That was my, sorry.
Yes.
That was my next question. I'm Karen Sowers with KUSI.
Mhm.
Does this change the amount of time that people are being quarantined if they were in contact with the person that confirmed to have the case? And then also, how, I guess, those masks, is that really, I guess, are they as protective as we think they are?
Yeah, so if you really were around somebody with a positive for coronavirus, you would wear more advanced personal protective equipment than those types of masks. That's why we consider those contacts either that middle range or low range in exposure risk. But again, you know, this is somebody who's actually otherwise well, has a fairly minor cough. We don't consider her very infectious, and there is some protection with masks. We think that, and it's a fairly short period of time, so that was our assessment. Yes, so let me also, this is causing some confusion also, especially whether or not the test is accurate. Again, the test remains accurate. We have confidence in the test. What happened is that in this particular case, this this child screened with some concerning symptoms when they first came off the plane. And they were then transferred to Rady Hospital and tested negative. Then they go back to the Miramar evacuee population, and since then, the child has then developed additional symptoms that we want to evaluate. So we've then moved the patient back to Rady for that additional evaluation. So this is the sole caretaker of this child. So the father does go with the child.
I want to go back to the fact that those samples were not tested, and they believe that they had been tested. Can you explain how that happened? Where was the mix-up?
Yeah, it was basically an issue with the labeling, and it's no fault of University of San Diego Health Systems. They have their procedures. We have our procedures. They didn't match up exactly. We had some information that wasn't on the label that we knew where they were coming from. But when they go into a laboratory that's separate from the testing laboratory, we have specimens coming to CDC from all over the world for all kinds of things, and they go to this laboratory to go into our laboratory information management system. They're accessioned and then parceled out to the different laboratories around CDC. So they require a type of identification. You can call it two-factor authentication, basically, to make sure that the sample aligns with a person. Not all that information was there, so it basically hit a roadblock right there, and they weren't then transferred to the testing laboratory.
Was this come down to mislabeled samples?
Well, I don't want to, University of San Diego and I'm sorry, University of California, San Diego, they have their own protocols that work for them, but there was a mismatch when it came to the CDC.
Was it ever discussed to be on that same page for knowing that there were evacuees at Miramar?
Well, we didn't realize that it was a mismatch until this happened, and since then we've made some changes. Do we want to?
Yeah, I just want to make a comment that, in general, what Randy Taplitz, R-A-N-D-Y-T-A-P-L-I-T-Z, an infectious diseases physician at UCSD and the Associate Hospital Epidemiologist. So we will often, when there is, a sensitive issue, we will give a patient a sort of a false name and, log them in. One of our concerns is always protecting patient confidentiality. So that was done in this situation. So that was how we kind of logged in the patient, and that's how the tubes got labeled. And then I think Dr. McDonald can also attest to the fact, because he was involved at this point as well, that this was discussed with the health department. So they were sent over appropriately to the health department and were, then sort of relabeled and sent via the health department. And as far as we were concerned, everything was totally fine. I will say that I just finished spending a very productive hour with the CDC team and our entire incident command center in kind of going through the absolute most excruciating detail of how these things will happen in the future. And we feel very, very confident that there will be no issues in the future. Do you want to?
Yeah, and picking up the thread for the county laboratory, I just want to be very clear that the paperwork that was given to us to fill out by the CDC was all filled out correctly. The specimens were in fact labeled correctly from the origin hospital, and the information about the alias names, that is the names that are used to protect privacy, and the actual name were all compiled together to send to the CDC. And so from our perspective, we had provided all of the appropriate information, and in fact we had given that same information to the team here at Miramar. So now that we know that there is a issue at the laboratory with accessioning, that same team that spent time with the hospital spent time in our public health laboratory to be very sure that this process of delivering a specimen from the hospital to the laboratory to CDC so it can be accessioned properly and then run has been improved.
Yes, sir.
How likely is it that because of the mix-up, we will see another positive case? Is that something that you guys know, or is it just based on those questions?
So, yeah, thank you for asking that, because what I want to emphasize is that when you take the big picture, things are running as they should for this response. The patient was appropriately isolated. There was no contact with the community. You know, we expected that there may be a positive case in this cohort because we know that they're at high risk of having been exposed. And so I want to emphasize that when you look at the big picture, that the community remains safe, those people at the base remain safe, the protocols worked, with the exception of one little laboratory piece that didn't impact the entire mission. The mission is on track, and we're doing the right thing.
I think any other questions on that topic, we will take offline. I do want to say, with all of the media interest on this topic, we also have a local resource for the general community to get needed information, and I'd like Dr. Wilma Wooten, our Public Health Officer, to make a few comments about that, please.
Yeah, there are results pending. I can't tell you exactly when they'll be back. Thank you.
Good evening, everyone. We recognize that the general public is very concerned about this issue, and we've set up a 211 call center. So if individuals in the public are interested in finding out more information, in addition, we want them to call 211, but also they can visit our county's website, coronavirus-sd.com. So again, 211 is available and waiting to take calls from the general public. Our providers call our epidemiology program, but we want the general public to call 211 to answer any questions that they might have regarding the coronavirus issue. Thank you.
Thank you, Dr. Wooten.
I have a question. We went after this person who tested positive. What happens to her now? I hear a lot of people talking about this deadly coronavirus, but then I also hear it's like the flu. I mean, is this person going to die here in San Diego, or what can you tell us about?
I can certainly speak to how she's doing now. She's doing very well. I don't think you would notice she was ill unless you saw her in isolation. So currently she's doing very well. We have every anticipation that she will remain well.
And is this something that she can recover from? I mean,
Absolutely. I don't know if anyone else wants to give any more details, but you know, what we're seeing is a range of illness in these individuals, from very, very mild illness to very severe illness. And even though the numbers are high, you know, most individuals will end up doing well.
And then I know just a lot of people talked to you today, and we talked about this mix-up. They kind of all said the same thing, like how the heck did this happen? It's the CDC. What would you say?
I think we've already addressed. I would say it was a reconciliation of protocols during a new and unprecedented situation. I think you all know that it's been over 50 years since we've had a quarantine in the United States, and thankfully all of those things have been worked out. Last question. Yes, ma'am.
Is the time that they are quarantined affected by this positive case and the mix-up? Will it be an additional 7 to 14 days because of?
Dr. Braden will respond to that, please.
So among all the evacuees that we have on base, you know, we've done that contact investigation. With the exception of 3, it doesn't change their situation. Okay? For those 3, they will have additional monitoring for the 14 days after this exposure.
And that's because of their contact with that patient?
Yeah, and again, we think it was at most a medium, but probably a low-risk exposure. Yeah, so it'll be active monitoring where people are asked and visited and about their symptoms, and the temperature is taken twice a day. We'll have to see if that is the case. It'll depend on all the circumstances at the time. But the recommendations and the guidance from CDC is that not necessarily under quarantine.
What about asymptomatic transmission? That has been speculated on out of China. Your approach assumes that asymptomatic transmission is not happening. Why is that?
So there is a lot of talk about asymptomatic transmission, and thank you for asking the question. It is something that we try to learn more about all the time. The information that we have so far with this virus, the information that we have from SARS and MERS, which are other coronaviruses, we put that together, and we could determine that it's possible that we can detect the virus in people before they may have symptoms, but whether or not they actually transmit that virus there's no evidence to say that that actually happens. We want to make sure that we're thinking about that. We want to, we maintain some social distance among the evacuees at the base, and so we consider that, but that's not how we think that the force of community transmission occurs.
Thank you. Thank you,
Yes.
Dr. Braden, that's all.
All right.
Actually, I'm just going to make a couple wrap-up comments. I just want to again emphasize there has been no known breach in the quarantine, and we are not concerned about any risk to the general public. The process has been in place, and we are confident that the process is working. I also want to emphasize, again, because it's been remarkable, the nature of the collaboration between our federal partners, our local health systems, both UCSD Health as well as Rady Children's Hospital, the County of San Diego, and our vast team that have been acting in support. We got this, and we really appreciate the time to share some of this information with you this afternoon. Thank you very much.